What are the signs of seronegative RA if tests are negative? Imagine feeling persistent joint pain and stiffness that just won't go away, even though blood tests show no signs of the usual rheumatoid markers. That's often the challenge with seronegative rheumatoid arthritis. It can be tricky because standard blood tests for rheumatoid factor and anticyclic citrullinated peptide antibodies come back negative, but the symptoms tell a different story. People with seronegative RA usually experience joint pain and stiffness, especially in small joints like those in the hands, wrists, feet, knees, elbows, and ankles. The stiffness is often worse in the mornings and can last more than half an hour. You might notice that the same joints on both sides of your body are affected, which is called symmetrical joint involvement. Swelling, redness, and warmth around the joints are common signs of inflammation, even if blood tests don't show the typical antibodies. Inflammation can be confirmed through physical exams and by looking at markers like erythrocyte sedimentation rate and C-reactive protein, which tend to be elevated during active disease. Even without positive rheumatoid factor or anti-CCP antibodies, these markers help doctors see that inflammation is present. Multiple joints can be affected at once, a condition known as polyarthritis, which highlights the systemic nature of rheumatoid arthritis. Along with joint symptoms, many people report feeling tired and generally unwell, experiencing muscle fatigue and malaise. Some may also have extra-articular symptoms, like eye redness or dryness, which can occur with rheumatoid disease. Because blood tests are negative, doctors relying heavily on physical examinations and imaging studies such as X-rays or ultrasounds to spot joint damage or inflammation. These images can reveal joint erosion or synovitis, supporting a diagnosis of seronegative rheumatoid arthritis. Diagnosing seronegative RA can take longer because it lacks the typical antibody markers. Doctors carefully review medical history, examine joints for signs of swelling and symmetry, and use imaging to find evidence of joint damage. They also rule out other diseases that might cause similar symptoms, such as other types of arthritis or autoimmune conditions. Early diagnosis is crucial. Starting treatment with disease-modifying drugs can help prevent joint destruction and disability, even if blood tests are negative. The key signs to watch for include persistent joint pain, swelling, stiffness, and inflammation that shows up on physical exams and imaging. Elevated inflammatory markers also support the diagnosis. Remember, every person's experience with rheumatoid arthritis can be different, so it's essential to work closely with healthcare professionals to get an accurate diagnosis and appropriate treatment. If you notice these signs, don't hesitate to seek medical advice for a thorough evaluation.